everyone. Welcome back to Clinician's Brief, the podcast, where we bring you the conversations behind our content. I'm the host of this program, Dr. Alyssa Watson, and today we're going to be discussing an emerging parasitic threat that is becoming a little bit more recognized in the southeastern United States, and that's rat lungworm. Joining me is Dr. Heather Walden. She's an associate professor of parasitology at the University of Florida. Dr. Walden's research focuses on zoonotic parasites and the spillover of invasive parasites from non-invasive hosts into the native Florida wildlife. So today we're going to be discussing what veterinarians need to know about Angiostrongylus cantonensis, its impact on companion animals, and why these cases actually might be on the rise. So welcome, Dr. Walden, to the show. I'm so glad to have you here.
Hi, thank you so much for having me.
Yeah, before we jump into this topic and these questions, I would love it if you could just introduce yourself to the audience and tell us a little bit about your educational journey and how you ended up at University of Florida.
Sure. My name is Heather Walden. I am an associate professor of parasitology here at the College of Veterinary Medicine at the University of Florida. I am also the president and member of the American Association for Veterinary Parasitologists, AAVP, and immediate past president for CAPC, the Companion Animal Parasite Council. And to get where I am today took several years, and my parasitology studies actually took me to Auburn University. I studied with Dr. Byron Blackburn, and then when I came to the University of Florida, I also trained with Dr. Ellis Greiner. So lots of parasitologists in my past.
Yep, some big parasitology names there. So I will tell you, this article that you wrote was fascinating. It was kind of my first experience with rat lungworm. So if you could, for me, things like the life cycle was completely new. Could you just walk us through the key stages, of development in this parasite?
Sure, of course. So the rat lungworm, or Angiostrongylus cantonensis, uses rats as a definitive or a final host. And then it has intermediate hosts, which would be slugs or snails typically. And it cycles through both of those hosts to complete its life cycle. And so in the rat, we find these adult worms in the pulmonary artery, right ventricle of rats. These females will lay larvated eggs. They then will hatch in the lungs, and you get these lung nests of larvated eggs and larvae, and then those get coughed up by the rat, swallowed, go through the intestine, out into the fecal material, where the snails and slugs ingest those larvae. Those are first stage larvae. And then once they're in the snails and slugs, they go through development to the third stage larva, which is the infective stage. Then that's the stage that gets picked up again by the rat definitive host. And then once in the rat, those larvae will be digested out of the snail or the slug. They penetrate the intestine of the rat. They enter the circulation. They go then to the central nervous system, where they develop to an immature adult, like an L5 stage. They re-enter the circulation. They're taken back to the pulmonary artery, and where they mature, and the whole cycle starts over again.
So when, I read rat lungworm, my mind immediately went to canine lungworms, which actually those parasites have a direct life cycle. And so, once I read how the rat lungworm develops, that seemed a lot more consistent with almost like canine heartworm disease, or even, there's another Angiostrongylus parasite that causes this French heartworm disease. So, does the disease manifest in rats more similar to like lungworm in dogs, or does it manifest more similar to, something like heartworm disease?
So in rats, there's a lot we're still trying to piece together as far as what the disease process looks like in rats. And so when we're talking about rat lungworm, specifically Angiostrongylus cantonensis, when we see it, and I know we'll get to this as we go through today, but when we see it in dogs, it looks completely different than what we see in rats. In rats, there is definitely a threshold of how many worms they can actually harbor before they start to see effects. I think some studies have shown, up to 80, and the parrot or the rat itself can still survive. When you get to 200 plus worms, you start to see neurologic impairment with the rat. But there are some things that occur, and again, this is all dependent on the numbers of worms in the rat, but you do see some disease occurring in the lungs. You can see granulomatous inflammation from the larvae. So, when I said that the females lay these larvated eggs, and then in the lungs of the rat, you have the larvated eggs and the hatching larvae. And so you can get some granulomatous inflammation just from the presence of all of that. And that can lead to alveolar destruction and pulmonary fibrosis over time with these. Just the presence of the adults in the arteries themselves can also cause physical trauma for the rat. There have been reports of it inducing pulmonary hypertension and things like that. And so while we can see some of those pathologic changes, we just don't know exactly, how it's manifesting in rats and in all the different areas, because it is not only in the heart and lungs, but of course there is that component in the brain. And so, you get all of those different things occurring in these hosts.
Yeah, and we're going to talk quite a bit about those neurologic manifestations, because that comes in, later when we're talking about what the disease looks like in dogs and humans. So we did talk about, the definitive host, the rats, and then the intermediate hosts, snails and slugs and things, but there's also these paratenic hosts, right? Like fish and crustaceans. So how do those contribute to transmission to dogs and humans as well? And what implications does that have for veterinarians and for public health?
So the paratenic hosts seem to be becoming rather a very important part of the life cycle of this parasite, especially as it gets transmitted around the world. And this is something that we're seeing worldwide at this point. And so the paratenic host is just another means of transmission for this parasite, and it occurs after that infective stage develops in the snail or the slug. And so at that point, when you have your snails and slugs with these infective L3 larvae, the paratenic host, which could be, and there have been several documented worldwide, but these paratenic hosts, could be frogs, lizards, freshwater crustaceans, lots of different things like that. And so they can ingest that snail or slug, and then that encysted larva will encyst in the paratenic host and just wait, basically. So you have that infective stage in that paratenic host. And so dogs can come into the picture and either, ingest an entire or partial snail or slug, or if they happen to come in contact with a frog that has an encysted larva, then ingesting that specific part of the frog or the whole frog, however, depending on what the dog
depending on if it's a lab or not.
Exactly. Then the larva will come out of encystment and then infect the dog. I know that there have been lots of reports of various species of frogs. In Hawaii, the coqui frogs have been identified as a paratenic host. Here in Florida, we found it in Cuban tree frogs. And so, when you have these dogs that like to play with frogs or like to play with snails, and it doesn't have to ingest the whole thing, just the right part, then that's when they can get infected. In the same way with humans. So humans that ingest parts or whole snails or slugs accidentally, that's how they get infected. Humans that might ingest in paratenic hosts, whether they're on purpose and they're just not fully cooked or whatnot, then that's how they can get infected as well.
Okay. So they originally thought that this parasite was endemic to Southeast Asia and Africa. And then it sounds like these paratenic hosts have really played a big, part in the spread across multiple continents. Are there other factors that have contributed to the expanding distribution? And if you could, just where exactly in the US have we actually identified cases in both animals and humans?
Sure. So in addition to just, the I guess the increased knowledge of paratenic hosts, and we're always finding new intermediate hosts and new snails and slugs that can sustain this parasite. Just the movement of people worldwide and the movement of animals, of their pets. Typically when people travel, a lot of times they take their pets, or they move, they take their pets. And just that movement of people and pets helps facilitate the movement of parasites and other pathogens, not just parasites, and not just rat lungworm. And so that plays a huge role. And when you get a parasite introduced to an area where all the conditions are right, so that the climate is right, the hosts are there, whether it's definitive hosts, rats are everywhere, intermediate hosts, paratenic hosts, when you get all of those together, then it's able to maintain itself, and then you start to see a spread and an increased transmission of those particular parasites, and rat lungworm is one of them. Here in the United States, we've seen it in Hawaii since the 1960s, and so it's considered endemic there, and it does infect large numbers of people, of dogs, and so it is something that they're very aware of, and they do a lot of things to try to educate the public, and a lot of outreach programs and things like that. And veterinarians are very aware of the parasite and what to look for. Here in the continental United States, it's been a while, or been around for a while, but it is still, I guess, in the grand scheme of things, fairly new. One of the first documented reports, and at least in a human in the continental United States, was in Louisiana. So we have it there. Other human cases just recently here in Florida. Texas has had a couple cases. There was one in Tennessee. Most of these are children. So coming in contact with snails, either purposefully, I think a couple of them were children that had ingested a snail on a dare. Others could be, I think in Texas, they attribute it to flooding. So one thing that we know is that when infected snails are drowned in water, the larvae will actually leave the snail. And so when that happens, the water is contaminated with the infective larvae. And so if you were to drink that water or wash your produce in that water or anything like that, then you have the potential of getting infected just that way. And so other places where we have seen this parasite in the continental United States, this is going to be rats, some of our snails and slugs. We've seen it in those in Florida. We've seen it in Texas, Oklahoma, Alabama, Georgia, Louisiana. There was a case of a miniature horse, I believe, in Mississippi. California, there was a falcon, but that one was attributed to food, and I think the food was shipped from a country in Southeast Asia. So that was brought over. So an area that was endemic for the parasite, I believe, was some kind of lizard, and that was shipped over. And so it wasn't a case where it's throughout California, but it was that incident. And so those are the places where we've just had reports. It's likely in more states, more regions. We just haven't found it yet.
Which kind of brings us to what should we as clinicians be looking for? And it sounds like, educating our clients about, what's out there. What kind of recommendations can we give to reduce infection risk?
Sure. So most of the reports in dogs have been in young dogs. Now, not all. And so a lot of the dog reports are either coming, there have been a few just published reports in Hawaii, although there have been lots of dogs infected in Hawaii. Most of the published reports in dogs are coming out of Australia, where it's, again, endemic. It's been there for a long time. Most of the dogs are young, but it doesn't have to be, like I said. And that just kind of equates to dogs that are interacting more with the intermediate host or the parasitic host, a young lab puppy versus, an older 10, 12-year-old dog who just wants to lay around. So, so you look for that interaction. Most of these reports are starting with, dogs that are lethargic. So they have reduced energy. These infections are also painful. Usually you'll see lumbar pain, the tail pain. They may be increased sensitivity. Sometimes you'll start to see urinary incontinence. With the parasite itself, when it's ingested, it will penetrate the intestine. And then after that, it'll make its way to the nervous system, the central nervous system. And so that usually takes about 11 days. When it penetrates the intestine, sometimes you could see GI issues. So diarrhea, sometimes vomiting. And so that will precede the neurologic signs that you would see later. In some dogs, you'll see ascending paralysis, hind limb weakness, and again, just that increased pain and sensitivity. You could see muscle wasting with these dogs. Also, when you look at them, they will have high eosinophil counts in their CSF. And to kind of mitigate the risk of getting infected with rat lungworm in dogs, a lot of it is just limiting interaction with intermediate hosts and parasitic hosts. Honestly, that's probably one of the biggest things that we as pet owners or that veterinarians could stress to pet owners to make sure that they're limiting that interaction as much as possible.
Okay.
If you've noticed your dog having difficulty moving, jumping, or playing, it could be a sign of osteoarthritis pain, or OA pain. OA pain is a chronic condition that impacts how your dog moves and feels. Do you think your dog is showing signs of OA pain? Know that treatment options are available. Ask your vet about what they can do to help control your dog's OA pain. Tap Learn More for details.
So before the break, you gave us quite a good list of some of the early clinical signs that we can see in dogs. How does this disease manifest in humans? Is it similar?
So in humans, it's very similar, and often it's divided into what we see in children versus what we might see in adults, or maybe some of our older children. Typically in children less than 10 years old, we see a lot of fever, vomiting. They lose their appetite, diarrhea. So a lot of that. And then, still seeing things like the paralysis and the weakness and the skin sensitivity and stuff like that. With older humans, one of the most common complaints is a headache. And so you see more of that, the neurologic signs in some of the older humans that are affected. So a headache, skin sensitivity, definitely pain, stiff neck. You could see paralysis, and all of these, whether it's in children or whether it's in adults, is dependent upon the numbers of larvae that are actually ingested. And so where if you, and this is also true for dogs, and so where if you just ingested just a few, and unfortunately I don't have like a set number, I can't say 1 to 10 is this and 10 to 100 and so on and so forth, but a few, relatively speaking, you may not even know that you were infected with rat lungworm, whereas lots of larvae, hundreds, thousands of larvae, then you are definitely going to see more neurologic effects, which could be more severe.
And we think a lot of these clinical signs are related to the migration of the larva once they enter the human or the dog.
Right. So the migration of the larvae, they're also growing as they migrate. When they come in contact with the immune system, some of them are going to die. So you have the inflammation from that. And with that, you see eosinophilic meningitis with not just human infected, but also dogs infected. And again, just the presence, the movement, the growth, the death of all of these worms in hosts that they're not supposed to be in.
Sure. So given some of that overlap in clinical signs, with other infectious and inflammatory neurologic diseases, can you walk us kind of through a diagnostic approach if we are suspicious of this parasite?
Sure. And the one thing to keep in mind is that there's a lot we don't know regarding exact ways to diagnose rat lungworm in any host, really. I mean, it's probably easiest to diagnose in a rat, and that's because it's the definitive host. And so you can do a lot with the rat and find it pretty easily. But when we're talking about our aberrant or our dead-end hosts like dogs, humans, non-human primates, horses, birds, any of that, becomes really difficult because you can't do a fecal exam and find larvae. You can't do a fecal exam. There's no eggs to find. A lot of the testing is not something you can do in a reference lab. So it's often, looking at, universities with researchers who might be doing stuff like this or along those lines, which, can be difficult. But when you're suspecting it, you want to start, of course, with history, looking at whether or not dogs actually have access or have they been around the snails or slugs, the parotinic host, are they ingesting them, playing with them, things like that. And so that's an important component of it. You want to try to rule out any other neurotropic parasites or pathogens like Neospora caninum, Toxoplasma gondii, canine distemper, fungal infection, that whole list. And so, ruling those things out can be helpful as well. This is something where typically dogs infected have that high eosinophil count in their CSF. And so that's a good place to start too. And when we're trying to diagnose it, PCR or ELISAs using CSF is probably the best diagnostic, but even then it's not 100%. And so there is still the possibility for a false negative with those. And so often you are going with the presumptive diagnosis in those instances if everything else fits. I guess the takeaway from that is that it's hard, and it's something that there are lots of researchers around the world working on. And so hopefully we have better diagnostics in the future.
Some things coming in the future. It can be very hard when we have a long list of things that we need to rule out. Mm-hmm. And I think also, setting clients up from the beginning that this might be, kind of a long journey when we have those types of weird or rare differentials, on our list is something that it's important to kind of think about in the beginning, just so that everybody can be on the same page with the fact that there might be a lot of tests that need to be run. And some of them, it sounds like, are pretty, can be a little invasive. CSF tap is nothing to sneeze at. So
Exactly. Yes.
So, can we talk a little bit about treatment if we are able to document this, or even if we're not? I guess that's a big question. So if we have a high suspicion for this, glucocorticoids, it sounds like, are a really important component of the treatment of this disease. And so why are we using steroids, despite the fact that generally I don't reach for steroids if I have a parasitic infection?
I know, right? It's very difficult to kind of change that way of thinking with this one. But what we found is that using the corticosteroids actually lessen the immune response to the antigens released by the larvae. And, as these worms grow and as they start to die, that antigen becomes greater. And so using the corticosteroids actually helps with the release of that antigen.
Yeah, so as you were saying, a lot of these clinical signs are related to just lots and lots of inflammation. So it makes sense that decreasing that inflammation is going to help. There also are some anti-parasitic treatments. Is that true? Can you walk us through when veterinarians should consider those? And then how do we mitigate? There's some risks associated with that anti-parasitic therapy as well.
Sure. So, it's this, and this aspect of it, using those anthelmintics is highly debated. And I think the consensus is starting to grow that they should be used. And using them when you highly suspect rat lungworm. And this, like you mentioned, the risks associated with that, stem from just not knowing how many larvae are in the animal. And you don't want a rapid die off of a bunch of larvae that are then producing even more antigen. And so that's always the fear. So that risk, what we found, can be mitigated by giving a gradually increasing dosage of the anthelmintics, along with the use of the corticosteroids, and that seems to help in a lot of these cases of these infections. Using the corticosteroids alone will not kill the worms, and so if you're only doing that, then you're basically waiting for the worms to die on their own. And so, adding that anthelmintic can be very helpful. And killing the worms is important because you're then making sure they're not getting bigger. You're making sure that they're not then continuing to migrate and cause more mechanical damage to the neurotissues in the animal.
And which anthelmintics do we think are effective against rat lungworm?
Sure. So typically the reports are using fenbendazole, 4 to 5 days of fenbendazole. You can also use moxidectin, which might be a little bit more potent, possibly, and milbemycin. Your macrocyclic lactones might be, a little more, but we're not really sure. Fenbendazole could be just as potent. This is another area, just like with diagnostics, we're still trying to work through and find the right combination of everything that works for these animals.
So beyond the anti-inflammatories and, some anti-parasitics, are there other supportive care strategies that can improve outcomes for these patients?
Absolutely. Like I mentioned earlier, this is a very painful infection. So you want to make sure that you're managing that pain. So that's a very important component of this. The other thing that we have found is that when the larvae penetrate the intestine, they have the potential for picking up that enteric bacteria. So that can then be transferred to the brain and the neural tissues. And so sometimes the use of antibiotics might play a role in limiting that, which again sounds very odd. Why would you give antibiotics to, a dog that's infected with a worm? But it's not necessarily for the worm. It's for the potential enteric bacteria that get picked up by the worm.
What about other kind of just environmental things, bedding and things like that? I mean, these animals, if they're having neurologic deficits, are we treating them almost like we would, a back dog or something, where we need to be making sure they're getting up and moving around? Or how does that look?
That's going to be dictated by the severity of the infection. Dogs that are suffering from severe neurologic signs typically have a poorer prognosis. Recovery is harder. And a lot of the times the treatments that are used are more efficacious in very mild cases of infection. That's when we see the kind of dramatic recovery and the turnaround in these dogs. In dogs that are severely neurologic, that recovery doesn't always happen. So, you definitely want to make them comfortable. And, just the like you mentioned, the typical things that you would do, absolutely. Anything to make them comfortable. Just keeping in mind that it is painful. They're having trouble moving and everything along those lines.
Okay. Yeah. And that was actually kind of one of my other questions was prognosis. So it really sounds like the factors that that influence whether or not they're recovering is really just burden, parasitic burden, as well as possibly how early we catch this.
Absolutely. The earlier you can start treatment, the better. And of course, that's true for probably any parasitic infection. But with this one, definitely the earlier the better, because you're catching them when they're smaller. They haven't done much of an extensive migration and things along those lines. But that doesn't control or doesn't kind of overshadow just the numbers of larvae that could potentially be there. So that's not something that we can control. Some snails and slugs may harbor a few, maybe 10, 20. There are some species that can harbor hundreds. And, eating one of those, could have pretty significant results.
So this parasite's really kind of a cautionary tale about, invasive parasites in general. What role do you think that we as veterinarians, play as public health, advocates and officials when we're monitoring transmission, or to, prevent maybe further introduction of some of these parasites into areas where we haven't seen them before?
Yeah. I think the most important thing that veterinarians can do is have that conversation with the pet owner about emerging parasites or emerging pathogens, especially if they know the pet owner is going to be traveling. If they have traveled, just making sure that they're aware and they have that conversation. Apart from that, continuing annual examinations, making sure that you're performing routine diagnostic fecal testing, blood testing every year with these pets, and also being open to the possibility of finding something new. And I think that's kind of an important thing. It's very easy here in Florida to expect some new parasite or new pathogen, and maybe not so much in somewhere like Ohio or North Dakota. And with, like I mentioned, with the movement of people and the movement of pets, you really have to keep that open mind, especially if they're kind of just a recent, translocator or they've taken a vacation. And then, kind of apart from, just that conversation and the testing and keeping an open mind, making sure that you're stressing the importance of keeping pets on monthly prevention for helminths, for, our arthropods and everything like that. So that monthly preventive is key.
Yep, that's great. Well, thank you so much for coming on the show and talking to us all about this. I said, when we popped on to start the recording, I said, after reading this, I kind of have a new fear unlocked, but also at the same time, I feel more prepared. And like you said, it is a great reminder to just be, vigilant and be open and be curious, because once in a while you might see something that you've never seen before, even in 20 some years in practice, like me. So
absolutely.
So there is one more thing at the end of our episodes. We actually have a little game. We like to call it rapid fire. I was hoping you would play with us. It's just for fun. They're fun would you rather questions. I fire them off at you and you just answer off the top of your head. There's really no pressure. Okay, ready?
Yes.
If you were on a long international flight, would you rather sit next to someone with a yappy Pomeranian under their seat or someone that wanted to show you their entire camera roll full of pictures of their dog's poop?
Oh my gosh. Probably the camera.
We'd go through everyone. This was last Tuesday. Because I've had that happen to me in the exam room.
Oh my gosh.
Okay. Would you rather teach students who are always 5 to 10 minutes late, but they are fully engaged, or always on time, but they are scrolling TikTok through your lecture?
Students that are late, but are fully engaged.
There you go.
Every day. Yes.
Every day. Awesome. If you could pick one to eliminate, but only one, would you rather eradicate all endoparasites or all ectoparasites?
All ectoparasites.
Really? Nothing itchy? Okay.
Yeah.
All right. Absolutely. That's good.
All the way.
All right, final question. This one's very important to me. I have to know your opinion on this. Do you think a werewolf would be a definitive host for Dirofilaria immitis like a wolf is, or would be a dead-end host like a person?
I think that a werewolf would be a definitive host.
You do. Excellent. I was going to say a dead-end host because like they're mostly a person for most of the time, except for that like one night a month, right? But maybe it depends on when they get infected.
Possibly. There you go.
See, that wasn't that bad, was it?
No, that wasn't bad at all.
Good. I'm glad you had fun. Thank you again so much for sharing your expertise. And thank you to all of our listeners. We hope you join us next time on the podcast.
Thank you for having me.
Thank you for joining us for today's episode of Clinicians Brief the Podcast. If you enjoyed this episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review us. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts, or drop us a line at podcasts@vetmedics.com. Clinicians Brief the Podcast is a VetMedics production, produced by Alexis Ussery and hosted by Dr. Alyssa Watson.